But one big change that was very difficult was I went from a position of authority to a place of low status.
Hello, healthcare enthusiasts, and welcome back to The Cure. This is the podcast where we are revolutionizing the business of healthcare in Africa, one conversation at a time. I'm your host, Temitope Coker, and in each episode, I sit down with the people shaping the future of healthcare in Africa, from founders to investors to scientists and beyond. And our goal is simple: to infuse hope back into the narrative by spotlighting the momentum and the progress that's already unfolding across the continent. At the heart of every single episode on The Cure is one question: what does it take to revolutionize the African healthcare business model? All of our insights are powered by TC Health, your trusted source for healthcare and pharmaceutical insights in sub-Saharan Africa. So let's get into today's episode. Today is all about the health tech sector. It's one of the most exciting sectors on the continent, and we have with us one of the biggest commentators on the sector on the continent with us today. The health tech sector in Africa has proven to be one of the most innovative and resilient sectors on the continent. It has ridden the waves of huge funding influxes and huge funding shortfalls, and it has scaled solutions in one of the most complex landscapes, the healthcare sector in Africa. It's, in my opinion, it's a very beautiful oxymoron. You have some of the most groundbreaking tech alongside clinics or facilities or infrastructure that is struggling to bear the weight of the needs of the people. And that is the landscape that our guest, Dr. Ikpeme Neto, operates in and is trying to innovate. Dr. Neto trained as an internal medicine physician at Trinity College Dublin in Ireland, which is actually my twin sister's alma mater. She did her master's in Trinity.
Fairness for winners is what we say.
Oh, I like that. She's going to like that too.
Yeah.
So shout out Tim Tayo. And he did his postgraduate medical training in Ireland and New Zealand. And then he moved back to Nigeria. And in 2017, he founded WellaHealth, which provides healthcare financing options for the next billion people through affordable microinsurance health products and tech-enabled health services. You may also know him from his essays on Digital Health Nigeria, where he's been chronicling the sector for years and calling out what works and what doesn't work. He's also one of the clearest voices on why we can't sustain the health tech sector with just hype alone, and why the path forward is disciplined financing and fit for purpose models of care. And that's why he's here today. We're going to talk about the work he's doing at WellaHealth, obviously. We're also going to zoom out and have a discussion about health tech writ large and the apparent renaissance that we're seeing in that space, in specific sectors of that space, as well as some of the funding models that work or don't work for health tech, and what it would mean to rebuild or revolutionize the business model around the realities on the African continent. So Dr. Neto, welcome to The Cure.
Thank you so much. Such a pleasure to be here. And amazing work you're doing with The Cure and with TC Health, of course.
Thank you so much. You've always been like a massive supporter and just someone who encourages me and someone who I can look to, especially as someone who loves to write. You love to write, and even doing all of the homework. Because I had a lot of homework for this episode. You are one of the
I do write a fair bit.
You are a very prolific writer, and that gave me hours and hours of homework for this episode. But it just reminded me why it's so important to tell these stories.
Absolutely. And you know, the trigger for me, so I started writing, there's lots of different tangents we can go on today and lots of different things we can speak about. But on the writing, I recall I used to religiously read Tech Cabal's newsletter. It was written by a guy called Osarumen, you know, quite intelligent analyst, gone on to do work with Facebook and, you know, lots of other things. But I really loved his analysis on technology. But then this was in 2018, I believe. M Pharma raised a seed or Series A, yeah, I think a seed, but it was $6 million. And it was really the first kind of high profile healthcare raise in Africa at the time. And Tech Cabal, that the newsletter that referenced that did it in passing. And I thought, this is not good enough. But I understood, because Asariman, you know, as you know, bright and as excellent as he was, didn't really have the insights around healthcare. And it was obvious that there was going to be a gap around health technology on the continent. And I thought, okay, maybe I should start commenting about it. And that was the trigger for me.
And the rest was history,
as they say. Exactly.
Yeah, I think this reminds me of our last episode. Dr. Yao was talking about how his response to some of the gaps he saw in the system was to found Yamachi. And when I hear what you just said, to me, I'm like, your response to some of the gaps in the commentary and the documentation of the health tech sector was to fill that gap yourself. And since then, I think it's almost a decade of chronicling, because your yearly reviews, which we'll touch on, started in 2017, 2018.
That's right, yes. So 2017, 2018, it's nearly a decade. It's hard to believe.
Yeah.
And I realized the impact of it when I didn't write it, I think 2 years ago.
Yeah, your 2023. Yeah,
that's right.
I was looking for it.
No, it doesn't exist. It doesn't exist. I was so busy and I was just having a really hard time and I just didn't have the time to write it.
Yeah.
And lots of people reached out and they were expecting and they were very disappointed. And so I realized then, oh, actually, this is a significant thing that I'm doing, you know. And so last year I said I better get back to do it. So last year's version is kind of 2 years in one.
Yeah. And obviously we cannot wait to see this year's version.
Yeah.
And some of the predictions you'll make for next year as well.
And my predictions not always, but I have a good hit rate.
You predicted some things. Predicted something. We'll touch on this when we get to that part of our discussion. But you've predicted some things that I find very interesting. And that's why I say, like, I'm curious to see what you predict for 2026, because those will be like some key watch outs.
Indeed. I do have to say my crystal ball is getting a bit foggy. So
really?
I don't know if I'm that great anymore, but yeah.
No, we'll just polish it a little bit. It's fine.
Okay.
But as always, before we jump into this discussion, I'm really excited to have this conversation. I just want to paint a picture of what I've been seeing on in the African health tech sector and why I'm an optimist in this sector. So I think the best place to start is with money, because where the money is, the story is.
Indeed.
Even when you said about M-Pharma, the money was there, the story wasn't there, so you wrote the story. And so according to some sector mapping, between 2019 and now, African health tech companies have raised well over $1 billion, and that number continues to rise. And that's huge. 2021 marked one of the most successful years in funding for healthcare in Africa, with close to 400 million in funding. 2024 was one of the toughest years in funding for the sector, with funding falling quite significantly. But even when we've seen some of those funding shortfalls, so even in years like 2023, years like 2024, across, because it wasn't just health tech, the whole tech ecosystem on the continent, we saw some steep funding drops. The health tech sector remained fairly resilient, which is why I call it one of the most resilient sectors on the continent. So in 2023, for example, despite the broader African tech ecosystem experiencing, I think it was almost 40% funding decline, the health tech sector only had about 2%. So while everyone dropped very significantly, we saw a drop, obviously, in health tech, but not as much as we saw for the rest of the ecosystem. And this is why I'm hopeful. In 2025 so far, and I saw this in your latest article on funding. Deals so far in 2025, according to the deal book, have more than doubled 2024, with almost 180 million raised in this year to date. And the sector it seems to be rebounding after a very tough 2024. And this year alone, there have been almost 50 deals in the health tech space. And some of the notable deals in the health tech space just in this year, Kera Health. So in June, the IFC, the International Finance Corporation, invested about $10 million in Kera Health. It's a Senegal-based digital health startup that uses an AI-powered platform to connect patients and providers and other healthcare stakeholders in West Africa. Maidawa, in May, Maidawa, a Kenyan health tech company, raised about almost $10 million to expand its services across East Africa. And they run a kind of hybrid e-commerce and pharmacy platform with online consults, e-prescriptions, testing, chronic care, delivery, all of those things. And then finally, in May, Aura, so this is an emergency response tech startup founded in South Africa, raised $15 million in Series B to expand into the US market. So we're starting to see health tech
export to other markets,
which I found very, very exciting because I know there's a few emergency response tech companies in Nigeria, across, different countries. And I think that's a very encouraging signal.
Absolutely.
In that space, but in the health tech space as a whole. And when you think about scale, I think it was back in 2022, Salient Advisory, they estimated that there are around 1,200 health tech startups operating across Africa. And that was right after that post-pandemic boom. Meaning that today there could be even more health tech startups in the African continent, and that number grows every day. So it's just a space, to me, that is bustling with energy and hope. And there's so many initiatives that are happening on the continent to kind of incubate and support the growing health tech startup industry. So usually when you look at who are the accelerators, who are the investors, incubators, you don't see as many health focused in the past, but now we're starting to see a few health and health tech specific accelerators. One notable example is Health Tech Hub Africa. They're a leading accelerator that's dedicated to scaling digital health startups that address some of Africa's most pressing healthcare challenges. And they have a physical co-working space in Rwanda, in Kigali.
Yeah.
And in 2024, they invested about $400,000 in 7 startups in Nigeria, Ghana, Rwanda, Kenya, and Tanzania to run pilots in their respective public health systems. And as a result of that challenge, over 900,000 patients were reached. Over, I think, close to 3,000 healthcare providers were trained. Almost 2,000 public health facilities were strengthened. The Health Tech Hub Africa is a key kind of incubator or accelerator in the space. And they're also a key partner for the African Health Tech Summit, which took place earlier this week in Kigali.
I was there.
You were there.
Indeed.
You were an attendee, but you were a speaker at the summit as well. And it just is a testament to this kind of activity that we're seeing.
Lots of great activity.
Yeah. And another accelerator and investor worth mentioning is Techstars, who are a leading commercial investor. And we've seen them very active in the Nigerian health tech market. So by volume, they've invested around $1 million in total across 7 health tech startups just in Nigeria.
Just in Nigeria, yeah.
We've also seen funds with specific health mandates arising. So things like Afric Invest, it's a Pan-African investment platform. They successfully closed their Transform Health Fund, THF, in October of last year at $111 million. And the fund is supposed to boost innovative healthcare models across Africa by addressing, health financing challenges and capacity gaps. Another notable fund is Leapfrog. We can't have this conversation without talking about Leapfrog.
Yep.
They made a full exit from Good Life Pharmacy in July of this year. And that caused a lot of buzz because under their stewardship, Good Life Pharmacy grew from like 19 to 150 stores, and they reached 2 million consumers across East Africa per year. And they became the leading retailer of pharmaceutical and wellness products in the region. And so that exit is one of the largest private equity-led retail pharmacy exits in sub-Saharan Africa. There's some other funds worth mentioning, AAIC, Django, and together with Leapfrog, they've raised over $1 billion in 2023 to 2024. So again, there is hope for the health tech sector. And I mentioned at the beginning that WellaHealth is a microinsurance and insurtech company. And so I also wanted to understand, as I was prepping for this episode, what is the health insurance landscape like in Africa? Just so we understand the context in which WellaHealth operates, the context in which your day-to-day is framed by. And according to Steer's research, as of July 2025, insurance penetration, so how many people or what proportion of the population is covered by health insurance, is quite, it varies quite widely across the continent. So in Ghana, for example, they report relatively high rates of almost 70%. And that's both public and private. Kenya is around 20%. And I know Kenya is transitioning from a national health insurance program to a social health insurance program. And that's causing a lot of challenges, but still hopeful. Nigeria has historically hovered under 10%. But and again, I always add the but because I think it's important to look at momentum. A key trend we've seen in the continent is this transition from voluntary to mandatory insurance. So a lot of governments are expanding coverage to reduce that out-of-pocket payments that we see that is very disproportionately high in a lot of countries. And some of the signals that have been giving me hope in the insurance space are, we've seen data recently from the Nigerian Federal Ministry of Health that points to a promising future. So since we've seen this NHIA Act in 2022, which moved Nigeria, obviously with the rest of the continent, from voluntary to mandatory, total enrollment has gone up significantly.
Significantly, yeah.
So official updates from late 2024 put Nigeria at 19 million enrollees.
That's correct.
That's 19 million Nigerians on health insurance. And multiple sources from 2025 indicate that now the total has definitely exceeded 20 million. And the biggest growing segment has been in the government-funded health insurance schemes.
Indeed.
With some growing 5 times in the span of 3 years.
Indeed.
So to me, this shows that the glass ceiling can be broken in terms of insurance penetration, because I think we hear about, and we'll get into some of the mentalities around health insurance in a lot of African populations, but there's always that kind of, can we ever really get health insurance coverage to where it needs to be? And to me, these are signals that, yeah, you can. You actually can.
Yeah, I mean, there's progress, certainly. Yeah.
And so this is all setting up our conversation with you. We're going to talk about where the next phase of durable scale comes from in the health tech sector. We're going to talk about insurance. We're going to talk about microinsurance. We're going to talk about tech-enabled care. We're going to talk about telemedicine, hint, hint, and things that are finally starting to click in Nigeria and across the continent. And just how can we keep this momentum that exists going sustainably in the future? And so that's everything that gives us a well-rounded picture of where we're at now, where we're at today. I've been following your work for years, Dr. Neto, and your writing has almost become the unofficial record of Nigeria's health tech story. And I think I said this to you right before we started recording. You gave me so much homework. Like, I prepped for this episode, and because you're such a prolific writer, I basically had to go through all of your articles from 2018, 2019, 2020, all the way to 2025. On top of those annual reviews, you have other articles. So there was a lot of homework, to say the least, to catch myself up and refresh my memory on a lot of the things.
I probably have forgotten a lot of the stuff I've written.
I will remind you. Don't worry. I took diligent notes, so I will remind you. Don't worry about that.
Yeah.
But before we get into those bigger themes and commentaries, I would love to take us back a bit. I know that you started out as a physician, as a doctor, which is the story of a lot of health tech founders and a lot of people that work in the healthcare sector. What is it that drew you from practicing medicine clinically to going into digital health, going into health tech?
Yeah, great. I think that when my desire has always been to deliver healthcare at scale, so for whatever reason, not everybody has this desire, but for whatever reason, I always felt like I wanted to impact the most number of people possible. And so I trained in internal medicine and I enjoyed it. I enjoy clinical work. I think there's no better feeling than having somebody come in, say pain or distress, and you're able to resolve that. It feels really good. But I always wanted to be able to do more. I wanted to do it at scale. And I also always felt that because I worked abroad, and I always felt it was unfair that, Nigerians and people like me were not able to get the kind of care that I was delivering when I was working abroad. And so I was always sort of drawn back, to figure out, well, how do we do it for Nigeria? And I'd seen that a lot of doctors that had left Nigeria to become, clinical specialists, when they returned, they did good work, but their impact was still capped. You were only able to see the, X thousand of patients that you can see physically. Whereas we know that there's millions of people without access. So that was always kind of my lens going through, medical school, training as a doctor. For me, the light bulb was really when I had to manage healthcare for my mom in Nigeria while I lived in New Zealand, and using technology to do it. I realized, actually, technology is the way. that the only way we can ever scale access to the billions and billions now of Africans where we don't have as many doctors is really figuring out how to use technology to do it.
Yeah.
And once I unlocked that insight, I packed my bags and returned. I said, okay, no more stethoscope. It's going to be the, computers and mobile phones.
I love that.
Yeah.
And I mean, obviously that is a really great story behind understanding the motivation of going from clinical practice to digital health. But I'm sure the transition from practicing medicine to moving into health tech was, in my opinion, that would have been a pretty big transition. And I'm curious, how was that transition, and how did the skills you used on a day-to-day basis have to change going from medicine, treating patients physically, to digital health and health tech?
Yeah, great question. I mean, the first challenge was my parents weren't most pleased.
Oh, I'm not surprised.
It's like going from doctor to essentially unemployed, right? Because I came back and I didn't have a job. I moved back in with them after I'd, left for years and was, earning decent income. I'd come back and essentially put all my money into the business and was earning nothing. And so that was the first rude shock, is like, you don't have a lot of money,
Yeah.
I mean, these days people can sort of raise some capital early on and perhaps pay themselves, but I didn't pay myself for the first couple of years, so that was difficult.
Yeah.
But I also knew that this was what I wanted to do. And I also knew that if I didn't do it early on in my career, I probably would never do it.
Yeah.
Because I'd heard so many stories of people that said, oh, I wish I did, or I wanted to, and then they were 60 and they just never did. I was in my late 20s and I was like, this is the time to do it. This is the time to take risks. So I moved back and I didn't have any money. One thing that was different, I think the training as a doctor is quite useful. You're very resilient. You can do anything, and you also have this belief that you can do anything. I've restarted people's hearts. I've had people come with strokes, and I've helped them walk out. So I think you definitely have a certain self-belief that perhaps others may not have as much. But that self-belief is also powered by kind of knowledge and understanding. And so I think one strength that I brought into being a health technology founder was I was just very voracious in my consumption of information. So I would read a lot. I would speak to a lot of people. I just wanted to know, I was super curious. I wasn't the sort of person that would just wait and hope that something would sort of tell me what to do. I'd go out and just kind of get a lot of information. So that was very helpful.
Yeah.
And also I was very experimental. And so I didn't fixate on one particular approach. I looked at the evidence, so in medicine, they teach you got to look at the evidence. What is the evidence? If there isn't any evidence, you've got to find a way to be experimental.
Yeah.
And again, all very, very helpful principles, when I became a founder. But one big change that was very difficult was I went from a position of authority to a place of low status. So when I was a doctor, people came to me to ask my opinion.
Yeah.
And I would give it to them and they'd be grateful and they'd try and go apply it. When I became a founder, now I was trying to convince people and I would go to them.
Oh, that's an interesting perspective.
And it was very difficult. All of a sudden, people didn't regard me as much. And that was a big change. And so I credit that experience actually with learning how to be a salesperson. So now I teach courses on sales because I had to learn how to do sales.
Yeah.
Because that switch is quite stark.
Yeah.
Yeah.
That's really interesting. A few points that I found interesting in what you just said. The first point was around this idea that as a doctor, you're coming from this place of authority and then you become a founder and you then have to learn to be a salesperson. That is almost, it's not word for word, but it's almost very similar to what Dr. Yao said in the last episode, because he came from doing his PhD, being a scientist just through and through. And then you found a company, you found a startup, and then you have to learn how to pitch. You have to learn how to sell your business.
I mean, your job is, as a founder, is sales. Convincing people to join you, that's sales.
Yeah.
Convincing investors, that's sales. Convincing customers, that's sales.
Yeah.
Literally, your whole life is sales.
Yeah. And I find that so interesting. And then also just this idea of like, you're coming from a place where people are coming to you to seek advice. They're taking your advice. And then you have to kind of go and flip the script
and
totally. Seek people
exactly
to take your ideas seriously.
Absolutely.
And then the second point I was going to raise was about how you mentioned that being a physician teaches you how to be resilient. You learn that you can do anything because saving lives on a day-to-day basis, I think, will teach you that you can do anything.
Oh, yeah.
And I had mentioned at the beginning that the health tech sector is one of the most resilient on the continent. And I know a lot of health tech founders have a medical background or a clinical background. And I was almost just thinking, I wonder if that's what's underlying that resilience
I think
of
so.
that sector.
Yeah, I think so. I think the healthcare professionals are super resilient. You know, we can deal with a lot of difficulty, perhaps to a fault. You know, because sometimes you shouldn't deal with that much difficulty. But I think, the profile of health tech founders, we're also super passionate.
Yeah.
You know, like setback doesn't stop us. We know that we fall down 100 times, we get up 101 times.
Yeah.
So I think, there's certainly a lot to be said for the profile of the people that found health tech startups.
Yeah. I found that really interesting.
Yeah.
And so maybe specifically for WellaHealth, because we've talked about your motivations for moving from clinical practice to founding a startup. We've talked about how your skill set had to change. But I'm curious, you could have founded any health tech startup, any idea, right? Why WellaHealth? What gap were you trying to fill when you founded WellaHealth?
So the short answer to that is I didn't know what I was doing when I started out. I honestly didn't know what I was doing. And I speak to a lot of newbie founders. And so part of my part-time work that I do and the stuff I do passionately is actually helping other founders, especially when they're new.
Yeah.
Because I recall when I started, I was clueless. You know, I made all the mistakes in the book and really didn't know what I was doing. So the initial idea that I had was because I was managing a lot of chronic diseases.
Yeah.
And, there's this talk of a double burden of diseases in Africa and Nigeria. Yeah. And I thought, technology could help with managing chronic diseases. And so that was my initial idea, is sort of a chronic disease care coordination platform that is able to take data and provide actionable insights to the doctor to help improve care for the patient and also to the patient to help them improve their own outcomes. So, great idea when you're sitting in, London, Paris, or New York, where the internet is wonderful, your doctor's connected and all that stuff, and all your data is digital, but not a great idea in Nigeria, because I arrived and I realized that all of the data is not digital at all. It's all analog. It's all in medical files. And so I was like, oh crap, this is not going to work. And so I pivoted then to trying to digitize the different verticals or the different arms of data within healthcare. And again, very quickly found that was very challenging. And I did a couple other things, but the common thread across all the things that I built and why they didn't work was financing.
Who's going to pay for it?
Exactly.
Yeah.
That was the question everybody asked at the end of the day. Is okay, this is your solution. Yeah, it's fine. It's good. But who's going to pay for it? Because it's not me. I'm already struggling to, collect money from my customers and you want me to do what? No. So that was the problem. Financing was just a big challenge. And so I said, okay, there is a clearly bottleneck here that has to be solved and that if solved actually enables the whole ecosystem.
Yeah.
And so I turned my sights then to figuring out healthcare financing.
Interesting. And so one of the questions I was having, and we'll get into this in a bit more detail, but obviously through your journey with WellaHealth, the business has grown. What did you learn about how people in Nigeria actually use and value healthcare? Because I was just thinking of, okay, why insurance? Why microinsurance? And you've just answered that question of the biggest question you would get is who's going to pay for it? How am I going to pay for it? And Nigeria, like other African countries, is a place where people are struggling to afford the basics. So when you add in healthcare, like someone having a health emergency can topple them into complete poverty.
Yeah.
And operating in that reality and with the Nigerian or even African mentality around insurance and healthcare, what have you learned about how people, like what works with how people use healthcare?
I don't know that I know exactly what works, but I'll tell you what I've learned and what I've seen. So there's talk of, what is the elasticity of demand for healthcare? So how price sensitive are people in relation to healthcare? And you'll find that people are very price sensitive actually.
Yeah.
And what that means is that if you increase the price of healthcare, they'll actually demand less of it.
Yeah.
Right? They will find workarounds. And you see how in Nigeria, for instance, the share of wallet for food, which is the big problem, is so high and it's increasing that there isn't any income for anything else.
Yeah.
And so what people are doing is they feel unwell, they will kind of, go to a local guy who's going to give them some advice. They'll kind of manage it. They'll, do their best until it's emergent. And so I divide, or there's a lot of literature that divides the demand for healthcare into two. So there's emergency healthcare and non-emergency healthcare.
Yeah.
So non-emergency healthcare, it's very price sensitive, but emergency healthcare, then it's more inelastic.
Yeah.
Because now you need it.
Yeah.
I think the mistake people do is they don't make this distinction, right? If you look at how Nigerians spend money on healthcare, most healthcare spend goes to curative procedures, curative spend.
Not preventative.
Not preventative at all. Yeah. It's all curative. And so healthcare becomes really important only when people feel acute symptoms that they need to resolve.
So it's almost like the price elasticity. There's a temporal aspect to it where it's like the moment you are faced with an emergency, because when people have emergencies, and I've heard this anecdotally in family members, friends, community, you will go around and ask all the people you know to fundraise, to almost crowdfund.
Absolutely.
Because you need to pay for your health.
So that's the big difference.
Yeah.
So if you have malaria, like you're not going to go beg people to give you, 5,000 naira or whatever to treat malaria. But if you get hit by a bus, like, people will donate.
Yeah.
So that's a fundamental difference, is that it's inelastic and people can find other sources, crowdfunding, friends, family, and fund it in a way that they wouldn't otherwise.
Yeah. Yeah. Oh, interesting. And we'll get into that because I feel like there's some mentalities around healthcare in Africa that I would love to talk about. But one other thing I wanted to touch on was a few months ago we had coffee and you mentioned that you got a master's degree in health economics. Congrats.
Thank you.
And you spoke about that journey in terms of balancing literally being a CEO and founder and being in school. Could you just for the audience, for everyone listening and watching, because I know that a lot of people are juggling multiple things. How did you, what made you go back to school? And then how did you have to balance building a company, actively building a company and balancing that with school?
That's right. Yeah, so it wasn't easy. But first of all, I write and I read a lot. So it wasn't, I really didn't change much of myself, to be honest. And so in that sense, it was relatively easy.
Okay.
I did do it part-time, so it was over a couple of years.
Okay.
But I already had the habit of reading a lot and writing a lot.
Yeah.
And which is what, grad school is. You read a lot and you write a lot. You do some exams as well, but I think the other thing medicine helps you do is medicine helps you.
You guys are always studying.
Exactly,
Lord,
and we're good at exams. Yeah. So medicine, like you get really good at exams, and so I, did a bunch of exams, but that wasn't a challenge because you just know how to like do exams.
Yeah.
That's one skill you learn. And so I think for me, because I actually enjoy that stuff, it wasn't really work per se. On the business side, it certainly helped that I have a lot of great operators internally in the company, and so in fact, a lot of my job really is more around thinking about strategy, which in fact the studying and the writing helps with strategy. So why I write a lot actually, to me, is me actually thinking, and trying to understand the landscape and trying to make decisions for the company. And that that reading and writing helps me, think through that clearly. And then just supporting the team, to operate the company, and have really great operators that meant the company kept going. And because in fact, now that I'm done with it, I'm almost like, have a lot of time with what do I do now?
Write some more.
Write some more. Exactly. I am writing more. In fact, I have two articles, coming up. But yeah, I think it's relatively easy to do if that is if that is how you're already set up. And in medicine, I think we are, so doctors are always doing exams, so even after you qualify, even when you're working, 60, 70 hour weeks, you're still studying, you're still doing exams. So it wasn't really like, terribly like difficult to do. It's just expected, in many ways.
Interesting. It's funny. I have my best friend. She is a doctor in the UK, and she is always studying for one exam.
There's always an exam. Yeah.
She'll work like night shifts, then the whole day, then whatever. She'll sleep, and then she's like, "Oh yeah, I have this exam coming." I'm like, "What are they testing you guys on?"
Exactly.
It's every month.
Yeah.
But two things I took from what you just said. The first thing is it teaches. This is a lesson for anyone building a company or building a team. So even if you're working within a company and you are building a team, I think it is very important for you to chase your dreams, to have a team that can support you while you're not as present or while you're not, as active within their day-to-day. Is if you have a strong foundation of people who know what they're doing, people who are smart, people who are motivated. Indeed. That allows you to branch out. And
it's not even that. I think so there's this book called Traction, and it introduces this entrepreneurial operating system for companies, and it speaks about how companies generally need two types of people at the top. One is a visionary, and you know where I stand. Yes. I'm clearly a visionary.
Obvious.
I have a million ideas. I have to stop myself from having ideas. Yeah. And you need an integrator. So an integrator is an operator, the person that, translates the ideas into like, proper progress, proper products, proper money.
Yeah.
And so the challenge some companies have is they do not allow the CEO is often the visionary.
Yeah.
They do not allow their CEO to be visionary enough. The CEO is too stuck in the weeds, trying to figure things out. Yeah. But that's not the CEO's strength. That's not the visionary strength. Sure, you can do it, especially early on. You've got no choice. I had no choice early on. I was everything.
Yeah.
I was even designing websites. But when you get to a certain scale, you do need that demarcation, the broad demarcation of a visionary who's able to think through things, be strategic, also be the face of the company, because that's a job on its own, So the fact, for instance, I was in Kigali, moderating a CEO roundtable, like that's important.
Yeah.
But it's difficult to do that if I've got to operate as well. And so key is, as you scale the company as a CEO that's a visionary, you got to find the operator and the integrator that's going to actually make things work. Because I find that when CEOs are too operational, you're losing. There's a lot of value you're losing. You need to bring people in that can operate the company, so the CEO is able to think.
Yeah. Who are your operators at WellaHealth?
I'm lucky to have a few, actually. Super lucky. Because again, people ask, how do you hire them? Honestly, I don't know. Hiring is very hit and miss, especially in Nigeria. It's really, really difficult. But I was really lucky. I stumbled on a number actually, not just one. And that's the advantage as well that we have, is we have a number of operators. So, my engineering lead, is super skilled, self-driven, able to solve problems, able to detect and solve problems on his own, which is really important.
Yeah.
Got a product lead as well. Similarly, great guy, able to detect and solve problems on his own. And then we've got operations lead, who's now my chief of staff because of some things we've moved around. Again, super able to just detect and solve problems on his own.
Yeah.
So it's really important that people can detect and solve on their own.
Yeah.
So essentially they're coming to you with an update that goes like, oh, I found this problem and I solved it. What do you think? Right?
As opposed to, here's this problem. What do you think?
Yeah. Or even as opposed to, you have to go find the problem.
Yeah.
Which is like the worst thing ever, So really lucky that I have, three of those people. But one thing that really made a difference for us was we hired a really great head of finance. She's ex-KPMG.
Okay.
And I think that really matured us a lot.
Yeah.
So bringing in sort of, corporate experience, and not just corporate experience, because some corporate people suffer when they come into the startup world because there's no structure.
Yeah.
Like it's the Wild West. Zero structure.
Yeah.
But you need people with corporate experience, but also have the personality to thrive in an unstructured environment and structure it.
Yeah.
And so, hiring her in a couple of years ago really matured us and made a huge difference.
Yeah.
And so I was, again, super lucky.
Yeah.
To be able to get all those people. And that has actually freed me up to be able to do things that are more strategic and be able to just think more clearly.
Yeah. I think I saw you both on a podcast in
That's
Dublin.
Correct. Yes, we were both on a podcast. Yes,
I
Anita.
To that.
She's fabulous.
Amazing. And another point that I took from what you said is this connection between writing and strategy. This connection between reading a lot, putting your thoughts down on paper, and that being almost the fuel for strategy. I think a lot of times people think strategy is just going to pop in your mind out of the thin air, but you learn a lot by observing a lot.
Indeed. Yeah. I mean, for me, strategy is research, you know, especially in our markets, you know, and you know this, there's not a lot of data.
Yeah.
You know, you can't sit behind the desk and know what's going on.
Yeah.
You know, so my writing, so a lot of my writing is actually as a result of conversations. So I'm speaking to a lot of people.
Yeah.
And then that's triggering me to go, you know, look at the research, look at the data. And then it's as I'm starting to form my thoughts around it and think around it, that's where the articles come out.
Yeah.
I have a lot of drafts, in fact, that, you know, probably will never see the light of day, but helps me think through all of that stuff.
Yeah.
So the basis for a lot of my articles actually conversations. And that's important because we don't have a lot of data.
Yeah.
The information we need are in people's minds. The only way you're going to get them out is by talking to them.
Yeah.
You know, and then supplementing that with some evidence, with some data, and then trying to make sense of it by, in my opinion, writing. Because as you write, you realize the gaps that you have in your knowledge, and then you go back and you try to fill those gaps.
And that's why I have such a deep respect for African researchers.
It's hard.
Doing research, just like being on your computer and going on Google or whatever search engine you use and trying to find data points, statistics in Africa can be very, very frustrating. And to your point, a lot of the data is sitting in someone's brain somewhere, and you just have to go and talk to them. And I know that as we look into the future, especially as we adopt more technology, there's going to have to be that backbone of data.
Absolutely.
So anybody chronicling data, whether that's qualitatively or quantitatively, putting it down on paper for other people to reference, I have massive respect for. Makes such a huge difference.
Massive difference, yeah.
Because you sometimes make assumptions and then you see something and you're like, oh, wait, the reality doesn't match my assumption. And then you unearth something like game-changing.
Absolutely. Absolutely. And so a number of master's students reach out to me and, you know, to discuss their projects or whatever. And every time somebody says, oh, I'm trying to do a systematic review or meta-analysis, I'm like, no. Don't do that. You know, there's not enough papers. You know, go to the primary research
and note it down.
Exactly. You know, so there just isn't enough for us to start to do, you know, systematic, you know, reviews, meta-analysis. The primary data is so lacking. So I always encourage people to go take the primary data and then write that up.
Yeah. Add to the database.
Exactly. Body of work.
Yeah. So, I mean, I want to dig deeper into the insurance landscape in Nigeria and what WellaHealth is doing in a bit more detail. A few months back, I think in August, you were on like a quick fire podcast, and you said insurance penetration in Nigeria is less than 3%, and that's a function of GDP. So not a lot of our GDP is from, I'm just quoting your words, not a lot of our GDP is from insurance. And that's a challenge because in your bigger economies, that number is 8 to 10%. So there's a growth that needs to happen.
Indeed.
And your micro health insurance products at WellaHealth are affordable. I think less than 500 naira a month.
Indeed.
And you can get access to care for malaria, typhoid, other common conditions. But you said that there are two main problems that you encounter. The first problem, education and trust. People do not understand insurance and they don't really know about it. And so that means that companies like WellaHealth and even your traditional HMOs, health insurance companies, need to spend a lot of money on education and creating that awareness. Secondly, building trust. So people often think, if I buy insurance, am I going to get a claim paid when I do go to claim for insurance? And the reality is that historically that's not always the case.
Indeed, yeah.
So insurance companies need to actually build trust by paying out claims, and that's going to create more experience, more trust, more testimonials, more education. So I guess maybe let's start from the second challenge and this statement that insurance companies need to pay more claims to build trust. How does, you know, because you're the visionary of WellaHealth, how does that principle shape the business of WellaHealth and potentially how it would evolve in the future?
Yeah, so we're in the business of paying claims. That's what we say. You know, the challenge with insurance is it's intangible. And I think our culture struggles with intangibilities. I think we like things to be tangible. You know, we really like something that we can see it, touch it, you know, but insurance is not that. But where does insurance become tangible? It's when there's a claim. And so it breaks my heart when people claim and then the insurance companies give them the runaround, or they reject them, or they make it very difficult. And I understand why that happens sometimes, but to be honest, if you want to grow this industry, that cannot be attitude.
Yeah.
And so our attitude has been, especially because we're dealing with low-income people, informal people in the informal sector who've really never had insurance and think everything is a scam. In fact, sometimes people think we're a scam because we're too cheap. They're like, you mean I'll pay you 500 naira?
It's almost too good to be true.
Exactly. And then I'm sick and then you cover me. No. No. So people think we're a scam.
I would love to listen into those focus groups.
People just think, it's a scam. This can never work.
Yeah.
So it's a big challenge. But the only way you overcome that, of course, is like by paying claims. But it's a bit of a chicken and egg in that how do you pay claims when you don't have customers? And so what we've done is working with partnerships. So who are the trusted brands or trusted enterprises within the economy? Can we create partnerships with them to borrow their trust, essentially, and actually start to give value to their customers? And we've seen a lot of growth there. So with the likes of telcos or mobile money operators, where we can embed, microfinance or micro insurance products within them and then start to pay claims. And we've seen that as we've done that, those people have gone on to be our ambassadors, evangelists, give testimonials that others see and then can come on board.
Yeah. And, I know you've had partnerships with, Stanbic IBTC Bank, MTN, the telco giant, over 75% of HMOs across Nigeria, several state health insurance agencies. So you're talking about all these partnerships. I'm curious, not that you can choose a favorite, I wouldn't ask you to do that, but if you could just explain one of those partnerships in a bit more detail, like walk us through how it works and why it works, just so we understand in a bit more detail.
Yeah, the first thing to say, partnerships are very difficult. We've done a lot of partnerships and most of them don't work. That's the truth.
Yeah.
Most of them don't work. And partly because people think that once you sign a partnership, it's uhuru, well done, job done.
Yeah.
That's where this job starts. After the partnership has been signed. The problem, of course, it probably takes you 2 years to sign that partnership. So there's a lot of fatigue all around and you kind of take that as a win. Whereas the work of the partnership is afterwards. And this is on both sides. And so what I found, I'm not going to pick a favorite, but what I found that works best is when you have real deep alignment on both sides. And the partnerships that have given us, say, 500,000, 600,000 customers was partners where they had internal champions within those other businesses that really believe that this product will make a difference. And so they were pushing internally. Because remember, every business has different priorities. So why should micro health insurance be one of their priorities? And so they have to make that case internally. Like externally, you can do your best, but there has to be somebody internally that believes that this product will make a difference. The more senior that person is, the better, of course. But you definitely need an internal champion. And so when we do partnerships, we spend a lot of our time. Well, now we've learned the hard way, of course, but we spend a lot of time trying to find internal champions, trying to cultivate internal champions, make them into believers. Very difficult. But once you get that, then the partnerships, are much better long term.
And, these partnerships clearly have given you unique insight into how these legacy players operate and how they can work together with, emerging players. I'm curious, how do you see those collaborations evolving in the future? I think we had coffee. You mentioned you're exploring even larger partnerships, and I'm just curious, what's next for you in that evolution of partnership and collaboration?
Yeah, so it's just more partnerships in that finding the right internal champions that can drive the growth. So in Nigeria, there's 200 million people. We've not even scratched the surface. And so our goal is really to just go more, dig deeper. And I think what we'll see over time is as we start to have successful partnerships, that makes future partnerships easier. Because you can point to a success story. And so I like this theory of the diffusion of technology, where technology isn't adopted, the life cycle around how technology is adopted isn't linear. And not everybody adopts it at once. Lots of people kind of wait and see what's everybody else doing. In fact, that was my biggest problem when I started out, is a lot of people I tried to work with would ask me, who else is using this? Who else is doing this? And my answer will be like,
well, about that.
Yeah, it could be you. So there's a flywheel that happens once more people come on board.
Yeah.
And as we start to do that, I think it also means that we can give more to customers because we're starting with a basic, simple product. As people taste that, we can sell them more.
Yeah.
So it's a basic micro health insurance, and then next is maybe a micro insurance with more benefits, going into traditional insurance and getting them to insure other things as well. So that they're then insuring their houses. Their cars is mandatory, but having much better insurance with their cars.
Yeah.
Having life insurance, which we don't like to talk about, but it's really important. Having business insurance. We see fires, theft, all of that. So all of those things will start to come. And our strategy is actually being there for healthcare, certainly, but beyond healthcare, once we have customers that understand insurance and trust our brand, is that we can deliver more. And, we're working with partners across Africa. That means we can take those models to other markets in Africa and have, a way to start to grow beyond just Nigeria.
Yeah. And I mean, you've hinted before at exploring partnerships or even joint ventures with some of the, larger microinsurance or reinsurance players abroad or globally. Can you tell us a bit about what that could look like? What are you exploring? What does that strategy look like in your mind if you were to paint the picture for us?
Yeah, so I think it would be the dynamics of the microinsurance business and doing partnerships is that you need a lot of partners.
Yeah,
like within even one product, so your partnership stack in one product could have 4 or 5 players. The challenge there is that a lot of times the value isn't commensurate to the work.
Okay.
So you're not always getting paid for the amount of work you've done when there's 5 people in a stack. And so what we felt over time is that it probably makes more sense to kind of contract that so that there's maybe 2 or 3 partners in a stack, because it's better for the customer actually. Because the more partners you need to pay, the more you have to charge the customer. And so that's where, speaking to say reinsurers come in. Is, how can we have the right sort of reinsurance and the right sort of licenses across multiple markets that mean that the distance between the customer and the ultimate, reinsurer is very short, so that we're not paying too many people in the stack.
But can you, I guess, because we talk about reinsurance, but I only heard of reinsurance a couple years back, because in the US, they are dealing with cell and gene therapies that are $2 million, $4 million for one injection. And a lot of US insurance companies are exploring reinsurance to just handle that massive check that they would have to write. So I'm curious, could you define for the audience reinsurance and give us the context of where reinsurance plays in? You've just kind of introduced that, but give us the context of where reinsurance plays in.
So reinsurance is, insurance companies buy insurance.
That's what really blew my mind.
People don't realize
insurance has insurance?
Exactly. So insurance companies buy insurance. Right. So when insurance companies buy reinsurance, when insurance companies buy insurance, that's called reinsurance. Okay. So they've reinsured themselves. And you buy insurance companies buy insurance from reinsurance companies.
Okay.
Now what reinsurance companies do is they pool risk across multiple markets.
Okay.
The way insurance works is pooled risk, right? Is, okay, today you're sick, I have to pay out for you, but there's 100 other people that have paid their premiums that are not sick.
Yes.
Right? And so that's how insurance works. So you can imagine that the more, the larger numbers you can pull together, the lower the risk.
Yes.
You know what I mean? So a reinsurance company would, pool risk from, say, 20 countries in Africa.
Yeah.
Right? So if you have an outbreak in one country, then, funds from the other country would suffice to sort of pay that off and make sure there's a buffer. So that's essentially it. You know, so there's a number of global reinsurers that they are massive, big companies, but they enable smaller players to pool risk so that they're not overexposed. And so you'd have, agreements where once you're paying out, say, over 60 or 70% of the premium that you've collected to your claims, then the reinsurance kicks in and sort of pays out the rest.
Okay.
You know, so that's how it is. It's just, it helps you to distribute risk a bit more.
Yeah. And it helps you to expand. It helps you to reach more people.
You reach far more people.
Yeah. And I guess, so the way I think about it is just in my mind, people are stacking up. So a company like WellaHealth, I don't know, you tell me the number of people that you have that are paying premiums for your products. Then you would work with other traditional HMOs that have even more people paying premiums for their products. Then the reinsurance takes, let's say it takes 5 HMOs, each with 5 million people. You have 25 million people. So it's all the likelihood of one person within 25 million people being sick is kind of shielded because of the scale. But if we zoom in, and this is just going back to that first challenge of what you said, building that education and that awareness, because 25 million, then 5 million, then 1 million, then 500,000, then the 100, then 1. How do we build around that African spirit? So keeping what works and what can be leveraged, but scrapping or moving away from what is detrimental. And the reason why I say this is there's a mentality, and anybody listening, please forgive me for generalizing. I hate to generalize, but there's a mentality within Africans, and this spans across economic groups, because you even have wealthy Africans who also have this mentality that nobody wants to think about insurance because you have to think about bad news. And that's very contrary to the entire ethos of what insurance is. Obviously, a lot of it is tied to culture, it's tied to religion, it's tied to education, willingness to pay, disposable income to pay. But how do you work around that? You know, one of the sayings I always think about, I don't know where I heard this, but it might be you, it might be someone on Twitter, it might be social media. Insurance biggest competitor in Africa is God.
Yes, blood of Jesus.
The blood of Jesus, and the blood of Jesus is powerful.
Exactly.
But when your biggest competitor is, no, God, I'm covered by the blood of Jesus. How do you even pitch against that? You can't. So I'm curious, how do you, when we get down to that person, that individual mentality or collective mentality, how do you work around that in the insurance space?
Yeah, great question, and big challenge, you know. One thing we've certainly done, for instance, is we don't use the word insurance a lot of time when we sell to people, you know. So we talk about a healthcare plan, you know, we talk about, don't you like to plan? You know, so I mean, who doesn't like to plan?
Yeah.
You know, so we kind of, I think the way you communicate is really important. You're kind of talking about plans, you're talking about being prepared, you know, you're talking about, you know, just being on top of stuff. So I think the communication side is important, and the way people talk about it is important. I think the traditional insurers haven't really been great at actually thinking deeply about, you know, how to communicate with people, because that's key. Because I think once you say insurance, first of all, people don't understand it, but there's a reflex rejection. But if I say to you, you know, you have a wife, you know, what's your plan? You're not going to tell me, God forbid, you're going to tell me a plan. Right? So I think that's really important. And that's where startups actually make a difference, because we are very customer focused or very consumer focused, you know, so we do a lot of customer research, you know, we experiment a lot, and we're kind of closer to the customer. I think the bigger traditional insurers, they're a bit too far from the customers, from the kind of retail customer, I should say. Because a lot of traditional insurers across Africa, especially Nigeria, they make money from businesses. You know, oil and gas, you know, big business, Dangote, all those people. You don't, like, when you go to Dangote or to an oil and gas company, like, you're talking about technicalities. You know what I mean? You're being super technical. Are those the same people that can sell to the market woman on the streets? Not really. You know, at best they'll go to a market storm and say, "Hey, Mama, you get insurance." Mama is like, "What are you talking about?" You know, so I think that's where startups are going to make a difference. Actually, is that, you know, we know the people, or we are more likely to know the people. We're open to learning, open to talking. We don't have legacy systems. We don't have legacy structures, and this is really important, because traditional insurers have legacy structures where they have to have, you know, a premium that's at least $1 million for them to get out of bed. You know what I mean? Like 500 naira, please. You know, so they're not getting out of bed for 500 naira. Whereas startups can, you know. So I think I'm very bullish and optimistic about what startups can bring to the insurance space. And and would like to see more traditional insurers support the startups. I think sometimes it might feel too much of a battle, whereas it could be more collaborative.
Yeah.
I think legacy insurers need to accept that it's probably not something that they can figure out, and that even if they do figure it out temporarily, they will still struggle long term because their DNA is just very different.
Yeah.
And so I think ultimately what the legacy insurers should do is provide resources to startups. And once startups grow and are successful, probably look at acquiring the startups to bring them in, to bring innovation in, to help them across their traditional lines and bring in new business as well.
Yeah. And I think we talk a lot about what doesn't work in the African spirit of, God is your biggest competitor for insurance. But like, what works that maybe people may be overlooking or we're not leaning on enough? So I know at the beginning you talked about price elasticity for healthcare in Nigeria or in Africa, and how once an emergency happens, you see that price become inelastic because or that price elasticity become inelastic because people are crowdfunding. People are going to relatives, people are going to, and a lot of, let me just speak for Nigeria. A lot of Nigerians are used to having family members, distant cousins, family friends who, when they're in a bind, they come to you. And it's not this, I think in Western cultures, it's kind of strange to be like, oh, hey, cousin X, I really need some funds. They'll be like, go to a bank. What's my business? But in Nigeria, it's just, if nobody's asking you, like, have people forgotten me? Like, what am I working hard for? So we've talked about what doesn't work, but in your experience, being close to the retail consumer, what works that we should be leaning on a bit more, or that has surprised you that works?
Yeah, so we've seen a lot of good points, So I think we're very communal actually in nature. So I mean, insurance is really quite communal actually. Yeah. It's actually about pooling risk and sharing risk. I think we haven't tapped into existing communities to work with them to explain how insurance kind of ties into their ethos actually.
Yeah.
And so where we've seen some success is working with, so there's Ajo, right? This rotational contributions where people go around and collect money for savings, and then, somebody collects it every month or week or whatever. And we've actually seen success in tying some insurance to it. But not saying, of course, we're not calling it insurance. There's a health benefit, right? So we're saying that if you contribute to this Ajo, we're going to take, a certain percentage, and then every time you're sick, you don't have to pay. We'll send somebody to you to, check your health now and again. We've actually seen some success there, and I'm really excited to scale those models. The challenge with those models is that they're very expensive. Very expensive to scale. Like, there's a lot of upfront investment you need in the agents, tooling them up, training them, and ramping them up to a place where they are individually profitable. So I think there is a lot of opportunity, and I'm optimistic because I've seen some data. But I think the challenge is that people are wary and they're not sure that the models will work.
Yeah. Interesting. And just to close out this section, because I would love to talk through your commentaries, but what do you think it will take for Nigerians to see insurance as a lifeline rather than a luxury? Like, what would it really take to flip the coin entirely on how the average Nigerian thinks about insurance? You've mentioned just even the way you talk about insurance, but what else do you think?
I think that's key. I think the way you talk about it is really, really important. I think that so where the government is struggling in Nigeria, for instance, so you spoke about how there's about 20 million people with insurance now.
Yeah.
A lot of that has happened over the last 4 to 5 years, literally doubled in that time. But there's a plateau, right? And people might not like hearing this, but the reality is that has plateaued. And the reason that has plateaued is because a lot of the enrollments were formal enrollments.
Okay.
So if you look at how it's broken down, a lot of it are formal enrollments. And where they are not formal enrollments, they're enrollments sponsored by the Basic Healthcare Provision Fund.
Yeah.
The true informal sector enrollment is nothing. Like, it's virtually negligible, and so growth there has plateaued. And so I think that going into the informal sector means we need to think differently about it.
Yeah.
So communication, of course, but also embedding. How do we work within the current spend that people have? So, and that's been our strategy is, can we embed these payments within existing things people use? So, there's been talk of a telco tax, for instance, that's going to go towards healthcare. We see that, tax reform is happening, and lots of, people are going to get into tax net a lot more. But I think embedding it into daily utilities, whether it's electricity, whether it's telco, whether it's whatever else, in a way that is automatic and people don't have to think about it. And in a way that is also small and, acceptable, so 10 naira there, 15 naira here, 20 naira there, and also make it almost dynamic. I think the power of technology is that you could almost sort of automatically means test people, if you like, and make it so it's somewhat progressive. And so one crazy visionary idea I have is, can we predict people's incomes and then based off of that prediction, dynamically apply a premium across the multiple services that they use? Visionary, but I think that's the kind of place we need to be, in that, if you're earning 100,000, maybe you're paying 20 naira every day, every time you say take a bus, for instance, or every time you buy pure water. And that is then pulled into a central pocket that then gives you a benefit. And I think as people start to experience this benefit, and there's talk of, more taxes now, people need to experience the benefits. Once people start to experience it, I don't think people will be more willing to pay. People will actively find ways to pay for things, actually, if there's a benefit, because it's like, oh, my neighbor was sick yesterday. They went to the hospital. It was fine. They didn't pay anything. I'm sick today and I'm paying. I'm foolish. Like, I need to follow, what others are doing. So that's kind of the way I think about it.
And at the beginning, you had mentioned how one of the biggest competitors in the wallet is food. And, as you were saying, what if you take a bus, you buy pure water, and a little piece of that is taken to fund. Maybe this is an ignorant question, but if the biggest competitor in the wallet for healthcare is food, obviously there's systemic challenges that would need to be solved for that. But how does that change the way that you think at all when you think of that being your biggest competitor?
Yeah, great question. And so even to take a step back, before healthcare is health, and food is health. So I was reading a paper recently where the conclusion was that to improve people's health, you need to reduce the cost of food. That was it. They said inflation, tracks with poor dietary choices, poor health outcomes, and then there's poor healthcare, and so people are not going to do well. So food itself is medicine, right? So I think on a kind of broader macro policy scale, governments need to figure out how to bring food down. Like food inflation needs to come down so that people just have access to better food and they can get better health as a result. And then when that happens, I think you'll find that we don't need to manage people's healthcare as much. And then perhaps there's more room then, disposable income for people to voluntarily pay. Or perhaps we can then sort of start to add on certain, taxes to actually, fund healthcare. Nigeria, I think, introduced a sugar tax.
Yeah, we wrote about it on TC.
Yes, but they didn't ring fence that though. Yeah. So I'm actually mad about that. Is why would they introduce a sugar tax and not ring fence it for health? So I mean, we can talk about that, for days, but if you're going to do something like that, I think it's important that is ring fence for health and healthcare, and it comes back to the people in much better services.
And I guess having this conversation about the space that WellaHealth operates in as it relates to insurance is incredibly informative, but WellaHealth also operates in the space of health tech in Nigeria, in Africa. So I want to zoom out to the health tech space more broadly. You've been documenting the space since 2017, probably before that, through your year in review essays. And like I said, that's almost a decade of chronicling the space and reading them back to back, because I literally was like, okay, let me read 2017. Okay, let me read 2018. It'd
be good to get your perspective, because I don't think I've done that.
Like I said, I did my homework, so I'm going to remind you.
Okay.
It almost feels like watching the Nigerian health tech industry grow up.
Evolve,
And there's even quotes in it. You mentioned the health tech space is coming of age in, I think, around 2020. So if you...
That was a bit premature though, wasn't it?
But I still think it's very interesting. And if if you would permit me and the audience would permit me, I just want to give the audience a brief summary of your chronicling just over the past 5 years. So we start in 2020. That's when the pandemic happened. There was some early pandemic optimism because it opened up this door to telehealth.
Yeah.
There was a telemedicine boom. There were warnings about feeding into the hype too much, right? And so just a few quotes, 2020 was an eventful year that nobody saw coming. Many health tech startups made the most of it and grew significantly. Then you said, I'm bullish on the prospects of health tech going into 2021, which was, in my opinion, the right attitude to have, because we then saw 2021 be a landmark year. And then you dubbed 2021 the year of partnerships to drive health tech innovation. And then you concluded the 2020 annual review with, the sector is finally coming of age. And I think as somebody who was already in the health tech space before the pandemic, and the pandemic kind of awakening more people to the need for health tech, I think that I agree with that. I wouldn't say it was premature.
But looking back though.
Looking back, yes, but no one could have seen a lot of the things.
Oh, yeah.
I mean, we've been living in unprecedented times since 2020. I'm tired of it. Is it even unprecedented anymore? Every other week it's unprecedented.
Yeah, exactly.
But I think accurately going into 2021, that was the right mentality to have, because 2021 was this funding surge year.
Indeed.
We saw consolidation, we saw lots of growth. We also saw some of the first reality checks, right? So you said 2021 has been a blockbuster fundraising year for African startups. And this goes back to our earlier conversation when you said, you've predicted a few things. And in your 2021 health tech review, you accurately predicted M-Pharma buying Health Plus.
Hey.
So you had just talked about Health Plus and some of the struggles they were having. And this was your quote: M-Pharma has been on the physical retail rollout spree in several markets. So maybe, just maybe, they splash out on a Nigerian chain over and beyond their franchising offering. And then in 2022, we saw Health Plus.
Yeah.
You also said more expansion is no doubt on the cards in 2022, especially as larger rounds happen and startups are pushed to grow rapidly by investors. So as we saw the 2021 surge, I think you had already picked up on, if a lot of people are raising VC funding, raising all this funding, investors are going to start.
Yeah, you have to grow.
They're going to start asking for checks, for
exactly,
receipts, for returns.
So that's what venture capital is. It's rocket fuel.
Yes.
And so once you receive it, you have to grow. It's not a choice.
Yeah.
Yeah.
And I think that kind of started the chain of what we saw come after that. But you still ended 2021 with, I've always been bullish about Nigerian health tech, and the growth over the last 5 years has confirmed this optimism. So you were optimistic. I think you've remained optimistic.
Yes,
even when we get to your 2023, 2024, I saw the optimism then, which is why we have you on this podcast, because I think the whole idea of the cure is optimism, is hope. And then we go to 2022, which you beautifully titled A Tale of Two Cities, where there was the mature startups that were doing well, and then there was some startups that were really struggling. You said the year began on a massive high with the announcement of 2 blockbuster fundraisers by M-Pharma and Reliance Health. They raised, I think, between them almost $80 million.
80 million, yeah.
By the end of the year, 2 prominent $1 million startups, so 54Gene, a darling of the pandemic era, and HealthLane, a YC-backed startup, suffered significant misfortunes. And then you said, if I were to capture what the year was truly like, I would say we're neither in bad nor good times, we're in evolving times. And the next 1 to 2 years are projected to be difficult macroeconomically and for raising venture capital, as investors have shifted focus from growth to profits. So as we just talked about, now that they've invested in you, they need to see that growth. They need to see that profit. You need to actually be a profitable startup now. And I think there was a lot of focus on who's raising. Oh, they raised this. Oh, someone raised 10 million. Someone raised. And so you said healthcare startups have, however, always been solving real world problems and may benefit from this return to proper business fundamentals of profitable growth. And so this is how you concluded. The mantra for health tech going into 2023 is healthcare local is now the turn for healthcare. And for any of our non-Nigerians that are listening, I'm just going to give you a bit of context. So this was in the presidential election going on at the time. Our now President Tinubu, his slogan was Emilokan.
That's right.
Like, it's my
It's
time.
my time.
So you like accurately, or I think
I like how you pick up on the nuances.
Yeah, like healthcare local. I was
Yeah.
like, oh.
Yeah.
So that was your spirit going into 2023. Obviously, we saw that 2023, 2024 became very tough
difficult,
years.
yeah.
And you mentioned you skipped 2023, as you said earlier.
I was having a tough year too.
Yes. 2023, I don't know what it was about 2023, but it just touched everybody.
Yeah,
like,
it was
if
hard.
you got through 2023 unscathed, come here. Let's
right?
just understand
Give us
what
the
did you do?
secrets.
What's the secret sauce?
Yeah.
But you called it weathering the storm. A funding winter, a lot of corrections, but also a lot of resilience. You said, I signed off with the hopeful idea that the coming years would be time for healthcare to flourish. This has proven too optimistic, as Nigerian health tech is undergoing a rough patch. The most obvious place to begin is with funding, or the lack thereof. The signs of a contraction in VC funding that surfaced in 2022 worsened. And so in 2024, African startups raised 2.2 billion, 25% less than the 2.8 billion raised in 2023, and a far cry from the 4.3 billion peak of 2022. And then this is how you predicted 2025. 2025 is set to be another difficult year that will require significant grit to survive. Investment will be slow. The startups and initiatives that survive this year will be primed for long-term sustainable success. So still hopeful. There's still some optimism, you know, in between the lines. It's still there. But just, I mean, reading these back to back, looking back across those reflections, I want to hear from your words, because this was my evaluation on what I picked up on, but I want to hear from your words. How did you see your own thinking evolve? Like, what were some of the predictions that even surprised you as you go on this journey of chronicling the health tech space?
I think the first thing to say is it's important to be optimistic. You know, I think you always have to be optimistic. I like an aphorism, where there's hope, where there's life, there is hope. I mean, where there's hope, there's life. Anyway, you always have to be optimistic, you know, because, I mean, if you're not, jump off a bridge, that it's over. Like, as long as you're alive, you must have hope.
Yeah.
And I also like the idea, somebody posted it on Twitter once, and I've taken it to heart, is that pessimism is lazy. It is lazy.
Yeah.
You know, it's easy to say that's not going to work. Well, of course it's not going to work. You know, but what's the story we can tell ourselves that can make it work?
Yeah.
Because the story of human progress has been us going against the odds and saying, well, chances are it won't work, but listen, we're alive, we're here, we might as well try.
Yeah.
You know, and sure, it might work the first time or the second time or the third time, or it might work for the first person, second person, or third person. But someday, sometime, somewhere, somebody will try and it will work.
Yeah.
You know, think of, you know, flying, you know, the Wright brothers, you know, so if you told people 300 years ago we'd be flying in metal boxes, you know, 40,000 feet up in the sky at 800 kilometers per hour, they just call you mad or psychotic. But we're doing it like it's a normal thing today. So I think I'm always optimistic. Like, that's just the default. I think you have to be optimistic. But I'm also realistic. You know, so I'm not one to be unbounded in my optimism. You know, I think you have to temper that with a bit of realism and know that things are difficult.
Yeah.
You know, and so I think that's kind of the balance I've always tried to play when I think personally and also when I write. Some people mistake that as pessimism. I remember somebody, you know, said to me, oh, you know, you're always talking about the negatives, you know, in healthcare and health tech, you know, in Nigeria. And I say, okay, fair enough. But I highlight them in a bid to talk about the opportunities that we can solve. You know, we cannot just blindly be optimistic and bury our heads in the sand. Like, things are difficult, you know, times are difficult, the country is difficult. But we do have to be optimistic. I think that we've seen like a lot happen.
Yeah.
A lot still happening. And I think that again, it's difficult because you're looking back and you know more than you did initially. But I think that, and there's an article that I wrote, we'll probably touch on this later, that perhaps the model for funding, I don't know that it's worked out.
Yeah.
You know, the idea that we can raise, you know, $1 billion from venture capital, we can grow quickly and exit and return capital to the investors. I don't know that that's been proven. And I think we had to try it. I'm not going to say that it wasn't a good thing to do. I think we did have to try it. But I think right now, the jury is coming back in slowly. And the verdict is like, I don't know about VC for healthcare in Africa.
Yeah.
And the reason for that is I think there's underlying infrastructure that's missing. And VC doesn't really work well when the infrastructure isn't there.
Yeah.
We need to build underlying infrastructure. And I think that the funding models for underlying infrastructure has to be diverse.
Yeah.
I think perhaps VC may play a role, but not a primary role. I think looking at government funding, for instance, that has to go up significantly. Donor funding, via grants, that also has to go up. And then self-funding. So, just growing organically from your business and your customers, that also has a place.
Yeah.
And then, potentially private equity.
Yeah.
So my attitude over the years now is that you need kind of blended financing. I don't know that raising 40 million from VCs, will get you there. I think blending it across, different types of capital, even debt, for instance, from banks. And so to use our own experience, we've raised some venture capital, but our funding has been very blended, so some foundations, so grants, winning awards here and there, doing some kind of small projects for people here and there that brings, $10K, $20K, $50K, that kind of keeps us going, pay salaries, go to the bank, get some debt, like we've, I think the only thing, not only, but, commercial papers is probably what we haven't done yet, you know what I mean? And we might do it, so I think you have to be very creative and just have a blended way of financing yourself up until the point where you're then able to kind of just survive, and then you're now able to grow because you've built the infrastructure for it. So I think that is where my mind is at now with regards to how to think about, kind of venture in Nigeria and Africa over the last few years in healthcare.
Yeah. And you know what? I'm going to jump ahead because I brought up this. I had read your article From Hypergrowth to Hard Reality, and it's all about, as we think about revolutionizing the health tech space in Africa, it raises the question of funding this revolution, right? And you recently wrote a Substack essay on, you asked the question of whether VC is even the right model for African health tech. Everything you've just described, right? You talked about this term called venture constipation, which I chuckled a bit when I read it.
Okay. I knew healthcare people find that fascinating.
Yeah, I was like, what? And I want to talk a bit more about that. And we actually wrote a piece for TC Health in 2022 that had similar conclusions, where it was like most traditional investment models often require these large exits or liquidation opportunities for investors. But the reality is that most health tech companies may not offer those huge payouts in your typical investment period.
Exactly.
In 5 years or 10 years or whatever, because there's so much to overcome.
Indeed.
To kind of scale. Like there's a lot of infrastructure that needs to be built. The conclusion back then was startups may become successful operating businesses that might offer dividends, that might offer cash flow payouts over the long term. But you are talking about, when you were talking about the different mixed models of funding, to me, I'm like, so health tech founders are becoming this like jack of all trades when it comes to raising funds. And I just want you to just, now that I've skipped ahead and we're in this From Hypergrowth to Hard Reality, just talk through in a bit more detail some of the models that you're now thinking of. We saw the Good Life Pharmacy and Leapfrog exit, which makes the case for private equity.
Absolutely.
But there's clearly, I think you've written about options like IPOs in European markets or other markets. So could you talk us through, when you say mixed models of funding, what really is going through your mind?
So I think a lot of times what people don't realize is that the capital you use constrains your strategy or affects your strategy significantly. So for example, if I go out and raise $40 million, right, the options I have are very limited. Because what I promised to raise $40 million from venture capital, what I promised to them is I will be able to return their money tenfold. That's the basic premise.
Yeah.
right? So if I raise $40 million, I should be able to build a company that is worth $400 million. What does $400 million look like as a company? So essentially means that depending on the multiple, let's take a simple math, 10x multiple.
Yeah.
So for me to build a $400 million company on a 10x multiple, I need to be making annual revenues of $40 million. It's not easy.
Wow. Yeah, I was like,
in this Africa,
I don't even know where to start doing the math.
Oh, right. So $40 million. Okay, let's break that down a bit further. How much is my average revenue per user, per contract, or whatever? $100? Is that fair? Let's use that simple math.
Yeah.
So to make $40 million a year on $100, I need, let's see the math here, what, 400,000 customers paying me $100. And you can kind of scale that up or down. If it's $10, $4 million, if it's 1,000, you know what I mean? Where in Africa today do you have those sorts of healthcare businesses? There are not many.
Yeah.
They don't really exist. So you're very constrained, essentially, when you go raise that sort of capital. Let's go to the other way and think, okay, where are the successful healthcare companies in Nigeria?
Yeah.
Where do we have data for it? It's public markets, So the challenge with private markets is we don't have data, so we don't know. Go to the public markets. Where you have success in the public markets in healthcare in Nigeria is in pharmaceuticals, right? So on pharmaceutical board, I think there's 10 to 12 companies. And look at how they've grown. So a company like Fitson, for instance, I think they did 80 billion naira in revenue last year. How did Fitson grow? They were importer, exporter, so they're importing some drugs, and the next thing they're like, oh, maybe we'll do this locally, one or two factories here and there, and then they got some, government grants, got some debt from the bank, obviously equity injection from their founders, selling drugs, of course, but they've kind of organically grown, and now they are fairly successful. They have big factories, nice big office in the mainland in Lagos, and are doing pretty well for themselves. And that's a model of success that's evident, and how they've done it is just growing organically, using debts, just being inventive and just, growing a normal business. Whereas with the VC side, we really haven't seen, a lot of success there. So it just feels to me like the model that has worked is that traditional model.
Yeah.
And the VC model, I think, the pressure you're under to deliver, and so the way the VC model works, for those that are not aware, is so venture capitalists raise money from other investors, and what they say to them is I'm going to go find innovative companies that can grow really quickly, and then within 10 years I can give you 10 times what you gave me back. That's essentially what they promise. And so once they invest, there's a clock that's ticking. So once they raise that money and start investing, a clock starts ticking where they have a fund where within 10 years, they have to come back and say, oh, we invested all of this money and they were able to return 10 times of that back. Simple. That's kind of basic math. So if they raise a $20 million fund, they want to make that fund go to $200 million. VCs are also smart and they know that that's an unlikely, it's unlikely to do that. So what they try to do then is they try to look for outliers. And they try to make everybody into outliers. They don't want you to sell a company for $5 million. They don't get out of bed for that. Remember, they're looking for $200 million back. So once they invest in you, they want to push you to make sure you get there. And so what they do is they look for companies that are potentially outliers and they push everybody. Remember, they don't need everybody to succeed. So this is what people don't understand about the VC model. When they say, oh, venture capitalists invest in companies and they all die. That's part of the plan. They don't need everybody to succeed. They need to push everybody because they don't know who's going to succeed. They make bets. So they make 10 bets and they push everybody. Most of those will not succeed. But the one that does, wild success. So traditional examples are like the Facebooks of this world, Ubers of this world, And so that's what VCs are looking for. But can you push people to succeed like that in healthcare? It's very, very difficult.
And in healthcare in Africa.
In Africa, exactly. We've done the maths and say, look at the number of customers you need to have if you're collecting $100 per customer. where we know that, the economies aren't that formal. You have a lot of informal people, disposable income is low, the healthcare systems are just, not great. And so I think there's just a mismatch in the expectations and the realities. And so my thinking then is actually, growing a lot slower, using blended options, and just being a lot more patient.
Yeah. It's almost like slow and steady wins the race.
Exactly. And VCs don't like to hear that.
Yeah, no, I would never put that in front of a VC. But this is tying back to the question that we always ask on The Cure. What does revolutionizing the African healthcare business model look like? From your vantage point, what would that mean within health tech? Because I'm hearing a story of we want a health tech and a healthcare revolution in Africa. It seems on the surface revolutionary to raise $40 million through VC and you're this big health tech startup. But is that actually going to revolutionize? And by revolutionize, create successful companies that last, that give returns, that are profitable, and that are saving lives, that are helping people. So if we were to bundle this conversation up, what does revolutionizing the African healthcare business model look like in health tech?
So I should also kind of make the comment that venture capital coming in hasn't been bad either. Nobody should take my comments to say that it's been bad.
Yeah.
It's actually grown the ecosystem, and we'll talk about this in relation to telemedicine. I think a key reason why telemedicine adoption has grown was because a lot of venture capital came to promote adoption.
Yeah.
So I think there's a lot that venture capital does. The challenge, of course, is if you don't return the capital, they don't come back. And so it's kind of temporary money, if you like, or it's difficult for them to come back. Some people argue that, it's cyclical, they will come back eventually, but that's a different conversation. I think revolutionize is a strong word.
That's why we like it at The Cure.
Yes, but the reason why I think it's a strong word is people are looking for things that are extraordinary. A lot of people approach me and say they want to work in health tech. They want to do innovative stuff. And I said, do you know what my day-to-day is? My day-to-day is very boring. Is selling malaria insurance. Like, that's boring. You know what I mean? Like, so I'm wary of using the word revolutionize, even though I use it.
Well, revolutionize the business model. And to me, when I think revolutionize, I think making it work the way it's supposed to work and the way that will lead to growth and sustainability.
Absolutely. Yeah, fair. And the way it will work is very simple. I think trying to reinvent the wheel or trying to do things, no. I think the revolution is in just doing the simple things and doing the basic things.
Yeah.
That's what I think, and so I think first is the government. I think the dynamic with healthcare is, you need decent governments.
Yeah.
You need decent regulators. You need all of those, which I think can be lacking a lot of times. But you do need that fundamental basic of, okay, are the regulators switched on? Are they doing the right things? Are governments investing enough? I would argue that governments aren't investing enough. And so I think we need a lot of advocacy on that side. And I mean, that's not the job of startups, even though you kind of have to do it.
Yeah.
But you do need a lot of advocacy on that side because, for instance, governments can catalyze the healthcare startup industry. So there's a startup that does emergency response Africa, and they got a contract with the Edo State government to run their emergency systems. Like, that's phenomenal.
Yeah.
You know what I mean? So we've been working with a few state insurance agencies as well, and we're helping them to, sign on people and grow. Like, that's phenomenal. So I think those sort of simple, like nothing amazing, but just governments, for instance, working with innovative startups, supporting them, giving them the contract, giving them the funding, for them to just do the simple basic task of understanding the customers, building the solutions, listening to the customers, and then actually just helping them. And then, of course, using technology, we know that there's not as many doctors as we need, not as many nurses, education is poor. And then using just simple basic technology that we already have, mobile phones, SMS, USSD, to just solve those problems. So I think the ingredients are there. I think what's fundamentally lacking is probably the will on the political side, if I'm being honest. And I think if we can fix that and build more infrastructure supported by governments across Africa, I think you'll see a lot of things happen. On the private sector side, I think another thing that can revolutionize things is actually private sector players collaborating more. And so at the roundtable I moderated in Kigali, one of the best comments somebody made was around, the conversation was around public and private sector collaboration.
Yeah.
And he said, hold up. We want to work with the public sector, but us private sector people here, we're not working together.
Yeah.
So how about we solve that?
Yeah.
And then we can go together to the government.
As a united front.
And say, look at what we've solved in the private sector. Can you adopt this? And I really took that to heart. Because I think that the sector can be very reticent to collaborate. We can be very suspicious of each other. There's a lot of rivalry.
Yeah.
And so collaborations don't often work. I think that where we are able to consolidate and collaborate, we could actually start to build some really amazing solutions that the governments have no option than to adopt. So I think, from revolutionizing private to just startups, companies collaborating rather than competing, I think will go a long way.
Yeah.
Because the irony of healthcare in a lot of places in Nigeria is that there is underutilization of existing services.
Yeah.
It's
so you want to build new services when the existing services aren't being used.
There you go. Like you'll be surprised. There are scanners sitting in this Lagos that are not being used. There are facilities that are empty, and we say, we don't have. So there's a mismatch.
Yeah.
Yeah.
And to me, this brings up. This is now the third of 3 of our episodes so far that this concept of collaboration has come up. Every single person that has come on here as we talk about the future, revolutionizing the African healthcare business model, has heavily emphasized the need to collaborate, the need for partnerships. And I think just one thing I've taken away from the season so far is that,
absolutely,
the importance of partnerships and collaboration. I guess my last question on this is, where is the hope angle here? What's the angle for hope as we think? Because to me, it's like, okay, tech. Everyone thinks, oh, this is so fantastic. It's so innovative. It's so AI this, AI that. We need all this funding. You
notice I've not said anything about AI, right?
Yes. And what I hear from you is, what if the revolution is quiet and patient, slow but sustainable?
Exactly.
And there is hope in that. Everybody wants to hear, oh no, we're going to use AI to leapfrog and piggyback off, blah, blah, blah. But what if the hope is in the quiet, the slow, the patient revolution? So I'm curious, as we round out this topic of funding models that work, revolutionizing the healthcare business model, what is the angle for hope here that you would tell to other health tech founders, to investors in health tech in Africa?
Yeah, I think that's it. It's patience, so, and I think there's a feature of healthcare globally, in fact, so the Institute of Medicine did a study around the adoption of health technologies and or proven health solutions. How long does it take for it to be adopted?
Yeah.
And it takes 16 years on average, and it's never fully adopted. So healthcare is slow. We just have to kind of accept that.
Yeah.
And I think leaning into that means that we are also kind of deliberate and work with that kind of scale and work together, because working together means we can potentially accelerate, a little bit more than if we, work them apart. So yeah, I think that's where my hope lies, is that there's a lot of people that are coming around to this idea. We've done collaborations ourselves. Where we'll talk about telemedicine again, but we don't hire our own doctors, for instance. We work with a telemedicine partner, we work with underwriting partners. Partnership has been our ethos. We think we've got specific expertise that we want to focus on and build out, but outside of that, we want to partner with others. The frustration, I guess, and to kind of say this, is that a lot of times people don't meet the same kind of standards that you would desire in partnerships. And again, to be honest, people will hear this and say, what about you? Well, sometimes you make errors. That's true. We're not perfect, but I think, having the mindset around working together to provide quality services that fits, the model that we have here. I'm optimistic that that's already happening, and we'll see it some more.
Yeah. And I know now that we have gone through all of that, we're going to rewind back and looking back about your writing since 2018 and introduce this telemedicine renaissance. I would almost call telemedicine the thorn in your side. For the last how many years, your reflections and your viewpoints on telemedicine have always been a constant feature of your writing, and it has been somewhat of on the not so bright side.
Indeed.
And again, I will just very briefly chronicle the several articles you've read. You've written like specific articles just on telemedicine. The first one I saw was December 2018, and it was titled "One Too Many." And you said telemedicine is all the rave in the health tech space in Nigeria. It's almost as if one launches every month. At my last count, there were over 20 startups operating some type of telemedicine service. Despite this preponderance of startups, the uptake of telemedicine has been poor, and many are struggling to see an appreciable number of clients. Undifferentiated telemedicine startups continue to launch without genuinely considering how they will tackle the barriers that exist to adoption. Whichever way startups choose to go, it's clear that the telemedicine race, just like most startup races, is a marathon and not a sprint. All should prepare accordingly. Then February 2019, you wrote for Nigeria Health Watch an op-ed piece, 10 innovative ideas that are not telemedicine.
I was sick of seeing telemedicine everywhere. Everybody was sick of telemedicine. It was like telemedicine every day. Yeah.
And you're like, oh, in my work supporting Nigerian health tech entrepreneurs, telemedicine apps have become a dime in a dozen. I see a new one almost every fortnight. The preponderance of telemedicine as a health innovation idea from many people bothers me. Surely there are more innovative ideas beyond the now standard chat with a doctor.
Yeah.
Then in 2020, we went from it's a marathon to the sprint within a marathon. 4 thoughts on telemedicine in a COVID-19 world. And you said COVID has now created this huge opportunity for telemedicine, and you hope startups can leverage it in a way that lasts. Despite this opportunity, you said, I'm still not particularly bullish on telemedicine as a standalone service. I'm, however, willing to be proven wrong, and COVID-19 has proved the perfect opportunity. So to all the telemedicine people out there, now is the time to get on your marks and sprint to the head of the pack. Then 2020, again, you had some more pessimistic thoughts about telemedicine. You said, while I've always been pessimistic about its prospects in Nigeria, there's now a clear opportunity to capitalize on the current scenario. But you ended, will 2021 finally be the year of telemedicine? Lie, I'm not a believer. And I was like, we almost had you.
Almost,
and you were close.
Almost.
And then 2021 comes. This year, telemedicine seemed to trundle along. We didn't see anything. It seems to me that standalone telemedicine is essentially dead. 2022 comes along. Telemedicine adoption didn't pan out globally, despite the acceleration in the early days of the pandemic. The jury is still out on the fate of telemedicine in Nigeria. Only time will tell how adoption will turn out. And you said growth will still be slow in telemedicine because of the cultural realities of our healthcare. That is just me in 5 minutes trying to summarize the thorn in your side that has been telemedicine. But, and this is a big but, now in 2025, your tune has changed a little bit.
You finally have me. Telemedicine has me finally.
I'm not going to steal your thunder. I really want you to talk through this new change of tone. But you wrote, a telemedicine renaissance is clearly afoot, and it seems to only be the beginning. And I read the piece, and I'd love to hear it firsthand from you. As your thoughts are evolving and crystallizing, because it was a draft piece. I'm very privileged to read a draft piece. Very good, by the way, amazing. But before we get ahead of ourselves, I actually want you to define telemedicine for the audience. Define the thorn in your side, and then talk us through this renaissance that you're seeing.
Yeah. So telemedicine is simple as, when you're consulting with a patient and you're not right beside them, essentially. That's it. At the heart of it, that's what it is. And so once you put it that way, a lot of doctors and nurses and healthcare professionals actually already do telemedicine. So put that out there. It already happens.
If you text your doctor on WhatsApp.
Thank you. Exactly.
That's telemedicine.
Yeah, that's telemedicine already. So when I talk about telemedicine, I talk about like formal telemedicine, where there's a business model behind it, where it's, clear business, all of those things. So like proper, structured, you're being paid for it, and, patients are using it, all of those sorts of things. So formal, structured telemedicine with a business model is what I refer to. Because informally, every doctor, every nurse, everybody does telemedicine, I'm probably going to pick up my phone in a few minutes. Somebody has texted me something. What's this result? What's this? What's that? So everybody does it informally. Yeah. So my challenge with telemedicine was that it felt like that was the only thing people wanted to work on. But it also felt like they were not aware of the realities. Yeah. In that, first of all, people just didn't know about it, didn't trust it, didn't want to use it. And so just spinning up a chat, doctor service just wasn't enough.
Yeah.
The second is that people didn't want to really pay for it. They didn't see value in it. And so a business where nobody's willing to pay for, very, very challenging.
Yeah.
And then the cultural realities of, like we said earlier, Nigerians, Africans don't really like intangible things. Telemedicine feels intangible.
Yeah.
If you look at how we spend on healthcare, I've referenced this already, we spend on curative medicine. People struggle to pay for services actually, because that even feels intangible. It's like, waiting doctor do safe, not just talk. So people don't value knowledge, right? And so it's very difficult, for instance, for a patient to go to a consultation and leave without a prescription. They feel like they've been cheated. They don't feel
it's
like
like I came here for medicine.
Give me drugs. Exactly,
yes. Yeah.
And so you bring a pharmacy. So that's why people like going to the pharmacy first. So if you look at all the data, something like over 40 to 50% of people, sometimes 60% in some cohorts, when they feel unwell, they go to the pharmacy first.
Yeah. It's anecdotally, like, the many times I've had malaria in my life, when I start to get those symptoms of malaria and people around me notice, the first thing they're like, it must be malaria. Go and pick up
there you go.
At the pharmacy.
At the
and
pharmacy.
I'm like, now that I've been working in healthcare, I'm like, I think we've skipped a few steps, but okay.
Yeah. And if you go, and this is you that's like, upper income, etc. I mean, lower income people, I mean, I, again, go to speak to people. I speak to Okada riders, Keke riders, and, their lingo is this. So when they feel a bit unwell, right, what they do is they go to a chemist, a patent medicine vendor.
Yeah.
And this is the phrase they say, Oga, mix medicine for me. That's literally what they say. Oga, mix medicine for me. Say, why not? My body, they do me one kind. That one too, now just... the more colorful the concoction, the better. I'm not even making it up. I've seen it. I've literally seen it physically. One red tablet, one white tablet, one blue tablet. This is the one. You go knock on here, knock on there. So that is the culture that people have. We want something tangible that we will take and will feel better. Yeah. That is what things like Agbo, that's what Agbo does. Yeah. And if you look at the Agbo composition, and a lot of sort of Chinese medicine as well, which is, similar enough, there's a lot of steroid in it. And steroid makes everybody feel better. Yeah. Like, if you feel a bit funny, take a steroid, you will feel better.
But you can't be on it long
Exactly.
time.
No, you can't, So you have all this kind of natural stuff that just kind of perks you up a little bit, whatever, but doesn't actually treat the main problem, or the problem just passes.
But it's tangible.
It's tangible.
Yeah.
I've paid you for something, you've given me something, I've drank it, And then they also have this thing where these traditional guys, I take a lot of inspiration from traditional medicine guys, charlatans, a lot of them, but they understand the psychology of people.
They know the culture. They know
exactly.
They have IP, intellectual
property. They do
on the customers that you're trying to reach.
Absolutely.
That IP is guarded.
Absolutely.
With them. Yeah.
So they go. So first of all, and the first thing I'll say, and it's a big departure from traditional medicine, from Western medicine in Nigeria, is the customer service of these guys. It's excellent. Their customer service is excellent. Again, in my interviews with customers, I say, why do you go to this guy on the street, this chemist, and you don't go to the hospital that is across the way? He said, if I go to the hospital, those nurses, they'll insult you, they'll leave you here, they'll do this. But this guy, he said, sit down. Hey, sorry. Oh, how mama, how papa, how boy, how girl.
They care about the community that you're in. They care whether your wife is pregnant, even though she's not with you. You're the one here. They care that your mother is in the house with you.
There you go.
But when you go to a hospital, you sit in a waiting room and it's very clinical.
Exactly, very clinical.
It's clinical, but it's
too clinical, you know. And I think we've removed care from healthcare. You know, we don't care. But part of the therapeutic, and they teach you this in medicine, is part of the therapeutic process is caring. You know, and so that's why doctors need to touch patients.
Yeah.
You know, I see some doctors that, you know, these days are not touching patients as much because they do the tests. They say, go get that scan. Part of why a patient comes to you, they want to be touched.
Yeah.
Because there's something in the touch.
Yeah.
You know, there's something healing about kind of that physical contact, you know. You know, you touch the patient and say, okay, I hear you, you know, I'm sorry about that. You know, is it here, it's hurting? Is it there? Or, you know, like you actually care.
Yeah.
And even if you don't give them a prescription, a lot of times they feel better. They leave and say, the doctor listened to me. And, you know,
I'm actually even feeling better. You know, that headache is not really, yeah.
So we've lost that.
Yeah.
And so my gripe then with telemedicine is that, you know, that kind of caring, that touch, that physical aspect just isn't there. And I think culturally we like that.
Yeah.
So what has happened over the last few years that has turned me over?
Yes.
I'll talk about that. Is one, a lot of awareness. So I think in Nigeria, Reliance Health came and they've raised over $50 million. And their approach is telemedicine first. Right? So they funneled everybody to say, no, before you go to the hospital, talk to a doctor. Yeah. So that was their model, right? And they forced that model and they had the finances to force it. Yeah. If you look at the other traditional HMOs, some of them did have telemedicine services, but they didn't really force it because they had that legacy of, if I feel unwell, I'll just go to my primary clinic or whatever. And so why would they spend money, time, energy, efforts to force a behavior change?
Yeah.
It wasn't worth their while. Whereas the whole ethos for Reliance was, we're going to make you go to telemedicine. So Reliance does a lot of telemedicine visits and calls. And what has happened is people now have the experience. Right? Whereas before there was no experience, now there's an experience of, actually, it's better. I could just take up my phone, talk to the doctor.
But you raise like a more macro trend that telemedicine has almost piggybacked off of people can order food global.
Thank you. That's the next point.
OPay,
exactly.
PalmPay.
Yeah.
Like people are getting comfortable with. I open my phone, I press a few buttons. There's a dispatch rider here with my package, with my food, or I will transfer you money, and it's right there, like that.
Absolutely.
So people are that telemedicine exposure, but also just the broader tech exposure in the country has made it's created the perfect storm.
That's right.
For telemedicine.
Yes. So the environment has changed. You're absolutely right. People now trust digital services a lot more. They see that it works. And again, that's all a function of the investment that has come in. So OPay, you reference, I think it's like $150 million they've raised. So a lot of money.
Yeah.
And they've really pushed adoption. Money Points pushed a lot of adoption. So people are more conversant now with digital services and using their phones. The other thing that's happened is people have grown up. People that are more digitally native have grown up and are now using healthcare.
Gen Z.
Exactly.
Gen Z is nearing 30.
Right? And, it's knocking on the door. Yes, and millennials as well. So you actually now have a cohort of people that are very confident and comfortable on their phones. So I think that's really changed the environment around telemedicine.
Yeah.
People are just more open to it. In fact, people want it first. And so when I did a focus group, so my dissertation or my thesis was actually on digital healthcare. So the features that people would prefer in digital healthcare. And everybody in that focus group discussion said that if a plan that my health insurer gives me doesn't have telemedicine, I will switch. So it's now a must-have.
Yeah.
That's how much things have changed.
Yeah. It's gone from a nice to have to a must-have.
Exactly.
And I think a lot of your gripes with telemedicine over the years has been, this still feels like a nice to have. This still feels like you guys haven't solved the problem that would make this a must-have. But now we've seen all of those changes.
And how it's being paid for as well. So now, remember, the challenge initially was a lot of these startups were doing standalone telemedicine. But what we're seeing is the telemedicine products that are successful are a feature within other things. So nobody's buying, well, not nobody, but very few people are buying just telemedicine.
Yeah.
But people are buying telemedicine as a feature within, say, a broader HMO plan, or a broader microinsurance plan, or a benefit added on to something else.
Yeah.
And that means that telemedicine component can be paid for. And so we've seen it in our business. I think last month we did over 20,000 telemedicine fulfillments.
Wow.
Right. And also you now have the services that enable home delivery of testing, home delivery of medications, pharmacy pickup of medications, which is what we do, really well at WellaHealth. Our WeFill business does pharmacy fulfillment. So over 3,000 pharmacies across the country. It's API driven. So once that telemedicine consultation is done, it calls an API, calls up your address, and you have the option to pick it up in a pharmacy or to have it delivered.
Yeah.
So you can imagine how your thing is done, 30 minutes later, drug is in front of your door.
Yeah. Yeah.
Right. So really making a difference to how people perceive it.
Yeah. I love that. And so now we have seen that there is a fit for Nigerian model of telemedicine design. You said in the past you think the idea of standalone telemedicine is dead. That was an accurate prediction.
I think
because
so.
now we're not seeing the telemedicine renaissance for standalone telemedicine. We're seeing the telemedicine renaissance for integrated telemedicine.
Yeah.
And I think, I love this idea of a telemedicine renaissance just because I remember specifically when we had coffee and you were like, oh, there's a renaissance in telemedicine. I was like, wait, you are talking about a renaissance in telemedicine? Am I seeing double?
Because I've seen the numbers, I've seen the numbers, like it's phenomenal.
Yeah. And so I guess if you were advising, because you do advise a lot of early stage founders entering health tech today, what lessons from that telemedicine arc, this story from telemedicine pessimism, telemedicine is dead, to telemedicine renaissance, would you want them to understand? Even if they're not in telemedicine or even if they're not in health tech, what lessons can somebody take from that evolution of how it's developed?
Yeah, that's a great question. I think the first one is to keep trying and don't listen to pessimists like me.
Even though people like Dr. Neto say your business model does not work,
don't listen to pessimists like me. But so first of all, keep trying, stay alive and keep trying and keep pivoting actually, you know. And thinking deeply about what is going on around you. So when you look at the research on what makes startups succeed, the biggest thing is timing. So a lot of times it's not really the idea, it's just that you launched it at the wrong time. And so what telemedicine needed is what we've discussed. Is you needed venture capital to come in, for people to be comfortable on their phones, for internet to be ubiquitous, people to order stuff online. So all of those things needed to happen. So if you launched in say 2016 and you died in 2019, sorry for you. Right? Whereas for instance, our telemedicine partner that we use a lot is seeing tens of thousands of patients. They only launched in the last 2 or 3 years. Now they are reaping the benefits.
They got the right timing.
Right? So timing. Now I don't know how to time a market. Nobody does. But I think is understanding what are the features, what are the background features you need for your business to be successful. And if they're not there, be honest with yourself and pivot. The story is also told of Uber, for instance. Uber would not have been successful if we didn't have digital devices that had GPS in them. No way. You could spend $10 trillion, it would not have happened. Or, Amazon that rode on the back of the US Postal Service. If the US Postal Service didn't exist, Amazon would be a disaster. So I think as starting an innovative business, you have to think, what are the factors that I need to work before my business works or my idea works? If they don't exist, be honest, and be honest with yourself. It's difficult. And I think the way you get honest is by talking to people like me. So I destroy your idea and then you go back and think about it. But what are the things that need to exist? Not be defensive, but listen and honestly assess that. And if you find that, those factors aren't there, go build one of the factors. You know what I mean? So perhaps what you do then is you build, rather than build an Amazon, you build the US Postal Service first.
And I think I find that interesting because there is this, you can't predict perfect timing, right?
It's luck, most likely.
But you can monitor certain proxies or indices or trends that lend themselves to your idea. If you're a visionary, you always have some idea in your head that you're like, this won't work now, but it could work in the future.
Yeah.
And if you map out what are the things, what is the perfect storm for that idea, right? And you track how those things are coming along.
Indeed.
You wouldn't get perfect time. Maybe you won't, maybe you would. It's luck. But you could kind of time it well enough without knowing how it would play out.
Indeed.
And that is just a plug for one of our next episodes. We're going to be talking about the data on the African continent from one of the largest companies that is compiling data on the continent to see what macro indices or factors are lending themselves to the healthcare space. Indeed. And how that could grow. But
it goes back to the initial thing I said about, being a student of the market. Like you need to be, I think the best founders. So what separates out a great founder is they choose good markets. And how do you know a good market? You have to be a student of the market.
Yeah.
And the student of the market means you're looking at the data, like you said, you're speaking to people, like you're in the industry, like you understand what's going on.
Yeah.
And so I angel invest, and I invest in founders that understand the market.
Yeah.
And it's easy to know in a couple of conversations whether a founder understands the market or not. And especially in health tech.
Yeah.
If I meet a founder, now not to toot my horn, but if I meet a health tech founder that doesn't know me, the chances that they'll be successful.
Not to toot your horn.
Yeah, because I write a lot. Yeah, you know what I mean? Yeah. I was looking for somebody like me when I started out.
Yeah.
You get what I mean? So if I meet a founder who's been, around for some time and they haven't come across my work,
I don't know about you.
Exactly. Because two Googles and in two Google searches in, like you must find something, and then there's an archive of stuff I've written. You need to read all of that, so that you start to understand the market.
Yeah.
So like the best founders, they really do their work to understand the market.
Yeah.
And because when you do that, you can not easily, but you can kind of have a gut feeling for timing, products, marketing, positioning. And I think there's something to be said for your gut feeling.
Yeah.
But your gut feeling is developed from actual data and research.
Yeah. So for everybody out there, if you don't know Dr. Neto, maybe you need to study him before you come asking for money. But I like that, being a student of your market.
Yeah.
And this ties well to the concluding discussion about building community in the health tech or digital health space in Nigeria. You built a strong founder community or innovator community through Digital Health Nigeria. It has over 400 founders.
That's
and
right. We're 400 people.
400 people in there. Founders, innovators, just people, healthcare enthusiasts,
That's
people
right.
who are invested in the healthcare space, the digital healthcare space in Nigeria. And I would love to talk about it on two fronts. The first front is just what inspired that. What gap were you trying to fill? The second one is, how do you see it evolving? I know in your 20s, this is when I was doing all my homework that you gave me, inadvertently, you mentioned in your 2021 annual review of the health tech space that the Pharmacists Council of Nigeria, PCN, released this draft guidelines for online pharmacy without really consulting the industry. And we've had these discussions on when we had coffee about your plans to grow Digital Health Nigeria, your plans to actually build around it to have that influence and discussion with policymakers, that they are able to consult a community of the founders and the innovators in the healthcare space. So I want to talk about both what inspired you to found it and also what are your plans for how it could evolve.
Yeah, so the inspiration was I was always looking for help, I'm very humble, like I don't know things. You know what I mean? I'm like, I was starting something new. I don't know what I was doing. So I just was basically trying to find out as much as I could.
Yeah.
And so what it meant then was I was connecting to people. And so I would Google and I would see that. So this was sort of 2014.
Yeah.
I would Google and I would see, this person did this. I'd reach out. Actually, funny story. When I started to look at health technology, so I told a very linear story of, I thought this was great, I'm going to come back and do it. Yeah. That was not my initial goal. I actually, because I was doing okay as a doctor. I was earning decently. Like my trajectory was very clear.
Yeah.
I was like, I'm not going to upturn my life.
Comfortable.
Exactly. And so what I wanted to do was, I believed health technology was the way.
Yeah.
But I wanted to invest.
Ah, okay.
That's what I was going to do. And I remember talking to the first 2 to 3 founders. I'm like, man, if I give this one money, right?
I don't know if you'll see it
I'm
again.
not going to see it again. And I was right, by the way. And I knew, because they did not understand the market.
Yeah.
You know what I mean? Me, that was like far away. I knew more than they did. And they were like in the business. I'm like, I don't know. And so I thought to myself, well, if not me, then who?
Yeah.
You know, because clearly there are not that many great founders at the time. This is at the time. They're doing this. I feel like this is the way, then, I might as well do it.
Yeah.
But I also entered humble. Do you know what I mean? Like, I came in and I was like, okay, I actually don't know what I'm doing. And so I still kind of kept talking to lots of different founders.
Yeah.
And so I was having sort of 6 or 7 parallel conversations with people in the space at the time. There were not many people in the space at the time. There were literally probably just a handful.
Yeah.
And I was talking to most of them. And we were essentially speaking about the same things. We're all complaining. We're all having a hard time, And then I was like, we need a community now. Like, all of us are, like struggling. At least let's cry on each other's shoulder, if nothing else. So that was the kind of genesis of it. Is, it was like 8 people, I think, was the first, group.
From 8 to 400.
Yeah, 8 to 400. So that was it. It was essentially, it was selfish. It was me trying to just find people I could cry to.
Yeah.
The journey is lonely and it's very difficult. In fact, yesterday I, was on a call with a founder who was just, in tears. Like, it's tough. It's really, really difficult. And I hope at the end of that call, she was able to pick herself up and keep going, because we need her to keep going. Like, she's doing incredible work. And so that's what I was trying to engineer with that community is, we need to keep going. This is important. We're passionate about it, but it's very consuming.
Yeah.
The community is supposed to help each other out. And so that's where it started, 8 to now about 400. And I think now the next phase is actually evolving to, like you say, providing sort of policy support, because like we are on the ground, we know what's going on.
Yeah.
It would not be right for the government to, implement policies that does not take into account our, expertise and understanding. Because I think the government is very removed in many instances from what's happening on the ground.
Yeah.
And I think having a formal vehicle that is able to interact with the government, I think is really, really valuable. I think in practice it's also difficult, because there's a lot going on.
Yeah.
But I think my hope and dream is that we can create some sort of body that's independent, that runs perpetually independent of myself or the founders of it, but that's able to support healthcare innovation from a policy perspective, but even also from the perspective of the people actually practicing and operating in the industry.
Yeah.
So whether it's in the form of beyond the policy side, building out a venture studio, doing some investing, all of those things that, founders need to keep going. So for instance, one of the ideas we've had is around having an angel fund. And I didn't speak about angels. So angels are important as well in the journey.
Yeah.
So my first investor was an angel, a doctor who became a finance person, loved what we're doing, gave me $20,000.
Wow.
Didn't ask too many questions. Thank God, because I didn't have answers. But he believed and he understood.
Yeah.
So creating that atmosphere. So people reach out to me and say, I'm a doctor in Houston or in LA, I'd like to support healthcare.
Yeah.
Who do I invest in? So having that kind of formal vehicle where we can pool funds, invest in certain, companies. So stuff like that. So really just help catalyze growth in industry is where I think the opportunity is and the vision is. It's just the time, effort, and energy.
Yeah. Yeah, to put into it. But I mean, I can personally, I'm in the group. I can personally attest to, just seeing, like, when people post about accomplishments, if somebody has won an award or somebody was at a conference and they don't post it themselves, somebody
will. Exactly.
And I'm relatively quiet, but I'm always just farming for ideas on what is going on.
Indeed.
And even when I was doing research for this piece, talking about certain accelerators, certain funds, there was some I wanted to plug and talk about at the beginning, and then I would check all of them on the group, like search on the group, and I was like, no, this one doesn't seem like it is what it is on the ground, so maybe I should just, let me just leave that out for now.
Yeah.
So it's such a useful
community.
Useful.
Oh yeah.
So useful.
Yeah.
But I know we've had a very rich discussion. I think you rightly predicted it would be longer than 90 minutes.
Oh, is it? Okay.
Yes. It doesn't feel that much
No, not at all.
it's been an amazing discussion. We like to close with some rapid fire questions. So we ask a question and you have to answer in 1 or 2 sentences. Very short answer.
Okay.
My first question, can you give us a sneak peek into your 2025 annual review? Just give us a little tidbit.
That's a secret. I have to watch this space for it. Yes. I think I have a title already, but it often writes itself in many ways. I mean, you probably have this experience writing as well, is that you go in with an idea, but like it just writes itself, like it comes out, and I get feedback from a couple of people and it takes shape. So I think the honest answer is it'll take shape towards the end of the year.
Okay.
I have some ideas.
Are you gonna share the title?
No, not yet.
Wow.
Because it'll change, you see? It'll change.
Okay.
Yeah. So it'll take shape. It'll take shape.
Okay. So everybody just keep your eye out.
And I think it's clear. Some of the stuff I've been writing is already clear what the themes are going to be.
The global kind of donor funding cuts, they have to feature.
Yeah, no, that'll feature. Yeah,
they have to feature. Yeah. But that has sparked a new generation of, we need to be self-reliant.
Oh, absolutely, yeah. I think it's actually a great opportunity. Yeah. I don't look at it as a negative. I think it's a great opportunity.
Exactly.
Yeah.
Okay, so that first question was shut down. We'll just have to see when you publish. What's one lesson entrepreneurship has taught you that medical school, business school, masters could never teach you?
That's a good one. Actually, I think the contrast between, say, medical school, masters, all of that is the answers are evident. They teach you the answers and then they set the questions and then you go get it's very clear. I think in entrepreneurship there are no answers. You know what I mean? And so what entrepreneurship teaches you actually is to ask the right questions.
Yeah.
I think in the traditional path is there are correct answers. There's no correct answer. Like the correct answer is no evidence, is what I should say in entrepreneurship. Is get good at asking good questions and then testing, and then the answers will reveal themselves.
Yeah. The next one, finish this sentence. The biggest myth about building in African healthcare is?
Biggest myth building African healthcare is you need more money. I don't think you need more money, at least not initially.
Yeah.
And more money doesn't give you success. I think that sometimes more money can be a handicap.
Yeah.
Yeah.
What gives you the most hope right now?
The most hope, I think, is the youthful continent that we have.
You're like the third person to say this.
Yeah, I mean, I think that's what's most hopeful about Africa. Everywhere else, I travel, across Europe, and they're old.
They're begging people to have children.
Like they're old. Giving birth. You go to Asia, they're old. Not that there's nothing wrong with old age, but there's a dynamism, there's an energy with youth. And the future is for young people. So I think that's what gives me the most hope. I think that, Africa is a young continent where median age is 19, something like that. Most of the continent is under 18.
Yeah.
So I think the future of the world is in Africa.
Yeah.
And that's what gives me the most hope, the most optimism.
Yeah.
Yeah.
And then finally, if you had to describe Africa's healthcare future in a single phrase, what would it be?
I think it'd be digital first. I think we're digital first. And the reason is that our young people are digital first.
Yeah.
And I think we have to build a healthcare system that is digital first.
Yeah.
And with the supporting infrastructure offline, but do a lot of digital stuff first. And we're going to find that the young people, they're going to be more switched on. They're going to be more savvy. And we can use a lot of digital technology to enable them get better healthcare.
Yeah. Nice. Dr. Neto, thank you so much for
you.
your perspective, your honesty, your leadership. I think for being a commentator on the African health tech space, I think anyone listening and has listened this far, well done.
Well done,
So many nuggets, so much just to take in. But as always, I leave with a hope and optimism of the future of digital health in Africa. Do you have any final words?
No, it's a pleasure. I want to say it's been great chatting to you, and well done on all the work. I know I write a lot, and you've been, great at reading it all. And it's been good to see that over the years, because you know how sometimes you're kind of writing and you're not sure whether it's resonating anywhere, or whether anybody's reading. But it turns out people are.
People are reading.
Yeah,
people
I want to say thank you for that.
Of course. And as always, you can find Dr. Neto on pretty much all social media
I'm easy
platforms.
to find, which is why if you don't know me,
yeah, no problem. And you can also find WellaHealth on LinkedIn, on their website. And if you're building in health tech, plug, join the Digital Health Nigeria community.
Absolutely.
As always, share this with somebody who is optimistic or needs a bit of hope in the future of healthcare in Africa. Thank you, and see you on the next episode of The Cure. Bye.
Bye.